treasurer's report. The balance is $2,275, and I will submit the receipt for the paper, and I'll get some folders to send the I'm going to buy some folders to send the certificates out with as well. But that's minimal amount. Recruitment and retention of mental health board members. I'm going to, we weren't recording earlier, so it looks like we have a new person being appointed in District 3, Vanessa Nava. And there's a question about whether Annabelle Nygaard has actually been appointed. So we'll check that out. So that would leave us with 2 openings, and 1 in District 5 and 1 in District 4. The minutes for March 16th, people should have received, and those will be emailed out, or they have been emailed out, and so we will approve them at the May meeting. Special topic. I don't think we have anything for this month. I don't know, is Carol here? I know she was talking, so Carol's not here. So we need to figure out what the special topic is going to be for this month, and we don't have one at this point. I was thinking that one topic that we should have at some point is a presentation by QIC. I don't know if Wendy and Erica are available to do that, but that's one idea to ask them. Does anybody have another idea? I know Carol was thinking about the jail presentation, but I don't know that that is available, and we'll have to talk to her about that. Okay, anybody else have an idea about a special presentation? Okay, so I can I'll contact Carol about the people, the presentation that she was talking about by the people who are looking at people with mental health issues re-entering society after being incarcerated. And I'll also contact Wendy and Erica and see if they can do a QIC presentation. Other than, whoa, somebody's echoing there. Other than that, I don't know. I don't have any particular ideas at the moment, so I will let Tori know who I'm successful with. Okay. Okay, Bill, I think you're on.
Good morning, everybody. Let's see what's happening. So there are a couple of new projects that have gotten the okay to move forward. So there's going to be news coming out about them. One is we partnered with the County Office of Education and applied to for a grant to the MHS OAC. So that's the board appointed to oversee MHSA, components of MHSA, and they got some money to distribute in grants. So the submission was almost a year ago. Sonoma County was not funded, but because they have additional funding, they have now offered to fund it. So we are scrambling with them to get that up and running. In brief, it's going to expand. It's largely going to be activity directly done by County Office of Education, and it's going to be to provide mental health services to students in schools. Our role will be to work with them with kids who need more services than can be provided by the schools and in the schools. So we will work with them to link kids to their benefits. If it's Medi-Cal, it's easier for us because we have access to that. If they have private insurance, we'll do what we can to help them access that. So I suspect, again, we're just now trying to, they were just notified recently, so we are all trying to remember what we wrote in the grant a year ago, and we're organizing ourselves. But ideally, this program will be launched in the fall. Ideally, that'll happen when the schools reopen, and the timing will be good for this. We have had as well on the MHS OAC side, they oversee the innovation funding of MHSA. We've had, we went through a process, I think several of you were directly involved in it quite a while ago, almost a year ago now, and we identified projects, and they've been very slow to respond. They're just now starting to respond. So a couple, I think 2 of the 5 projects have now gotten the go-ahead from them to move forward. So we will announce that soon. We hope, because the notification was recent, that they're getting through their backlog, and we hope we can hear on the other ones as well. One potential topic for an upcoming board meeting would be to invite Melissa Ladresh to come and give an overview of the projects, or perhaps she could bring staff from the projects themselves to share with you what those innovation projects are going to be. There's going to be 5, as I said. I believe 2 have been okayed, and I didn't remember the name. Okay, so we have an early psychosis healthcare network and Nuestra Cultura Cura social innovation lab. So those 2 of the 5 have been approved by the MHS OAC and will be moving forward. RDA, I've mentioned that RDA is in the process of doing a SUD system mapping and planning project. So the first step was to collect data. They've done that. They're now initiating the focus groups. So there will be some announcements regarding the focus groups. There's a survey out that's available to everybody, and I just sent that to Tori this morning and asked her to distribute that to you. You are welcome not only to respond to the survey, but to send it to whoever you want. RDA is going to focus on responses from particular stakeholder groups, and just because of the scope of the project, the division will collect information from the general public and work on an analysis of that. So that's out. We had our first budget presentation with the board last week, so that information is out, nothing notable. I don't have much to share right now because the budget process is still pretty dynamic. I think part of that's because we have a new supervisor, so the board's getting used to being a new group. And then we have a lot of active variables in the system. So MST planning with the cities is very active right now. Santa Rosa and Petaluma have committed to bringing up their own mobile support team, Cahoots, and we are actively planning with them to integrate our programs. and I could offer an update on that at some point, what the details are of that. And the Measure O funds there, so there's this new revenue source, and the board is trying to figure out how to make decisions about that. So that has just created a much different dynamic. It's not as straightforward to figure out what to do because we've got more options, which is a good thing. I think that's it. I don't know if there's any questions, anything you all have been wondering about that I didn't touch on.
Bill, how about just overall, how does the budget picture look this year compared to last?
So I really cannot speak about details because I really don't know. I have to say the board, it's a much different process than in the past, which is to say I can't forecast what's happening in the way I've been able to in the past. But I'm not worried. I think that I don't see any big holes that I'm worried about. I hope I'm not wrong on that. I will say that, the division is struggling and that we're still short of resources. So for example, the priority we're working on right now is our caseload size. So our caseload sizes are twice in youth and adults, are twice what we are staffed to handle. And we're seeing the outcomes you would expect, more crises, more hospitalizations, and we, our problem solving that. We're trying to figure out how to move forward with that. It's a little bit hard without having a director. Tina Rivera was placed as the interim yesterday. So we now have an interim director, which will be helpful, but in most cases, boards and departments don't want to make big decisions when there's an absence in leadership. And if it takes 4 months for somebody to get here, it just may be a process by which we don't get as much done as we'd like to. I hope that's not the case. Everyone here is actively working on trying to move things forward. We're just not sure.
And how is the inpatient unit that Crestwood is going to be staffed?
So that continues to move forward, and the date continues to be pushed back. So the current date is opening in October. And again, that's quite simply the logistics of the permitting process and getting through all the hoops you need to go through in California to open a facility. So they expect their license to come in September, and that they would begin admitting clients in October.
Financially, that should be a positive, though, shouldn't it, for the behavioral?
It'll probably be a wash financially, but it'll be a much better service system. So I think that we'll save some money and it will cost some money, and that I'm thinking is probably a little bit of a wash. But the big advantage is just care improves and the system functions better, right? So right now we just have parts of our system that are languishing. People are languishing, and that's not good for them and not a way to run a mental health system. So mostly looking forward to getting folks out of the CSU and out of the emergency departments and into treatment quicker. I think that's going to be the biggest benefit to us.
And the last time you said you've been successful in recruiting a couple of people for positions.
Yes, we have a CSU manager. So if you've been tracking our troubles, Sid McCulley has been functioning as a CSU manager now for about the last 3, maybe 4 months. And the new manager, Angel Cassidy, started week before last. So Sid is working with her to orient her, and we should expect over the next month or so, Sid will transition back to her position. Wendy remains in the vaccine DOC most of the time, so we don't have her available to us as a section manager right now, and we don't have any date when she will be able to transition. The DOC is working on hiring replacements, so the process is happening, but it just has not resulted in somebody being able to replace her. Diane Madrigal our section manager in SUD has announced her retirement. So she will be leaving, retiring at the end of May. So we'll be recruiting for a new SUD section manager. We started the paperwork, but the announcement's not out yet. And then we have just finished interviewing for a cohort of clinicians. So we'll be making offers to probably another 8 to 10 clinicians over the next couple of weeks.
So I have a question about, were you done, Bob?
Yeah, yes. I think I've asked enough questions.
I have a question about housing. Is there progress being made in, I know that there's funding out there, but is there progress being made in increasing housing that is available to our clients?
I mean, so things that are happening, I think you're aware from the news. So the purchase of the 2 motels, and those are now housing folks, and there are plans to remodel them and improve their ability to house folks. So that is actively happening. After that, you know, there's money coming our way, but there's no way yet to access it. So the state budget has $750 million available to counties to invest in infrastructure. So that's primarily purchasing property and building facilities. And so we're waiting for opportunities to apply for that. And there may be money in the Federal Act as well, but there's no clear information about what may be available to us. There are a number of projects that are in the pipeline. These are projects that are funded by No Place Like Home. Those are, you know, a couple, 3 years out. So the projects have been approved, the projects are in process. It's going to take a while to build them and bring them online.
So I fairly recently was looking at housing that for people who are conserved, and most of our conservatees are placed outside of county, right?
Mm-hmm.
So is there any plan to figure out how to bring some of those people back?
You know, the best opportunity would be for that $750 million for us to apply for, you know, funds that would, you know, enable us to do that. Because we don't have a lot of direction from the state, I haven't done a lot of planning about what we will apply for. We pretty much need everything everywhere. So, I mean, we could use sobering centers, we need permanent supportive housing, we need transitional housing, we need facilities like enhanced board and care facilities like Dave's Guest Home. So it's not going to be a problem coming up with good projects to apply for. It's just a matter of understanding what the application priorities are so we can do that. But that certainly should be one of the considerations on the table. You know, a simple project would be to acquire a building and the county owns it, and then we RFP for a vendor to operate a facility in that building. So we'll look for that. I will tell you that politically there's a dynamic in the community now that because of the purchase of the motels and the reaction neighborhoods have had to that, I think that NIMBYism, that's a pejorative term, so let me retract that. I think that neighborhoods being concerned about having facilities nearby is getting a little bit more attention because the county has brought in facilities and upset people. So I predict that will be maybe a more difficult dynamic than it has been in the past moving forward.
Yeah.
Bill, I have a question.
Yes.
It may not, yeah. What about the old county hospital? What's the plan on that in terms of housing, if any?
Yeah, the county wants to sell that property and use the proceeds to, well, I don't know what they want to do with the proceeds, but the county's intention is to sell that property and bring in revenue for the county. The buildings are, my understanding is they're beyond their useful life. They're remodeling them or repairing them, I don't believe is an option, and I believe that's part of the thinking around selling the property for development so that it would be available for local housing, to meet local housing needs, and assist the county with revenue.
Thank you.
Well, I want to say that on the conservatee idea that what I learned, and I am thinking that it's accurate, is that we have 191 people conserved and 108 are in locked facilities. And there's 57 out of county and 27 in county. But 12 of those I know are in a facility that has a year maximum. So that means we've only got 14 housed in county long term.
Are those LPS conservatorship numbers?
Yes.
I don't have those numbers, so yeah, interesting.
Yeah. So yeah, so I think that's a very small number of people for us to have housed in county. So I would advocate for increasing that because, those people probably would like to stay in county rather than being placed, at a distance. So that's my little advocacy there. And information for the rest of the board on what I found.
Yeah, I mean, if you have those numbers and notes you forward, it's always helpful for me to have numbers on hand when I talk to folks about what we need. Okay,
I will send you those numbers. I was actually very surprised. So, okay. Any other questions for Bill?
I have a quick question around the clinicians that have been recently hired. Are we, and I know that there aren't very many bilingual or bicultural bilingual clinicians, but did we hire a few or no?
So we haven't made offers yet. We just finished the process is rate the applications, do a first interview that is a general interview, and then a second interview that is program specific. So they're moving into the program specific. What I'm told is it was a very small, we were worried because it was a very small number of applicants, but we are happier because the people that applied are really well qualified. And I didn't ask how many are bicultural, bilingual. I will say that I'm starting to make some decisions about creating positions above behavioral health clinician that are bilingual required. I'm not sure we're ever gonna make a dent in getting bilingual, bicultural folks into leadership without doing that. And I have strong interest in creating some Latinx specific programs over the next year or two. And so we will need managers. So we're starting, clinical specialist is the position we use to get ready to become a program manager. You get experience that makes you competitive in that application. We're starting to identify clinical specialist positions as bilingual required, and we're going to see how that goes.
Got it. And would these clinicians be working with the Sonoma County of Education project that you had originally talked about?
Probably not. The County Office of Education position is, or project has one position for the county. So it'll be, and we're trying to figure out right now what we're allowed to do. So when I said a year has passed, so things have changed. And so we are talking to the funder about changing some of our ideas. One of our idea is to make that a clinical specialist position. And it will be term limited. It's highly likely that internal staff will want that position as a transfer. Again, because clinical specialist positions are a step toward promotion. So, and because that's a time-limited position, it wouldn't be prudent to make it a bilingual required, because that delays hiring, and we'd lose the opportunity to use the grant funds if we don't fill it as fast as we can.
Right. Good point. One last question. What is our role and how are we involved with Sonoma Connect? The new ACES Aware project. I think that's what it is. Yeah, the new ACES now.
I'm not sure if we are connected. I know that we've been shorthanded in administration. And I know we talked about this and we want to get involved. I don't know that any of us has been able to connect to it. I think that if we can get all of our section manager positions filled, we may be in a better position to participate, but there are a number of community projects we're not involved in, we ought to be. So that's one of the reasons for building out our administration a little bit this year.
Got it. Yeah, and that makes sense. It's a fairly new project. It's the funding just arrived not too long ago, and it's ran by Sarah Rock. So maybe we can ask her to come in and talk about maybe ways for the mental health board or mental health department to get involved, because they're right now in the beginning stages, but I do think that they should put us on the radar just so that in planning we play a role, or at least we have a say in what that role may look like.
And I have been, now that you say her name, I have been in communication with her, and I'm embarrassed to say I can't remember what we're talking about. I think it's likely Karen Salidi. It's likely that I've asked Karen Salidi to follow up, but I'll go back and find out what's happening with that.
Perfect. Thank you. Appreciate that.
And thank you for pointing it out.
Okay, any other questions for Bill? Okay, I'm not seeing any hands or hearing anybody, so.
So if you don't mind, then I'm gonna leave the meeting. Because we're in budget, I have a number of homework assignments that I'm doing for the supervisors. So I'm gonna take advantage of you guys being done with me to go work on them, if that's okay.
Sure, and watch for my email on the conservative.
Thank you.
Thing.
I
Okay.
appreciate that.
Thanks,
All right, take
thanks,
care.
Bill.
Thank you.
Kathy,
Yes.
could I jump in 1 second? I just want to make a verbal request. Peterson, would you check your chat messages for Zoom, please? Thank you.
Okay. Okay, so the next.
I didn't understand the request.
I think he asked you to look at your chat. There's probably something in there from him.
Okay, thank you.
Okay, I got a couple of more ideas out of that discussion for the special topic presentation. So I will also contact Melissa Ladresch and see if one of those programs, the innovation projects, might be able to present it as well. I know that the Nuestra Cultura one that might be really real interesting. And the early psychosis one, I think, would be prepared to talk because they are collaborating with a statewide project that has other partners. So that one might be one that we can get, but it's short notice. So that gives me more options. I also think that we had talked about having a retreat. I'm going back to board planning. And it looks like May 22nd is the one that most people are available. The last time I looked. Why don't we set a morning retreat and we will discuss the last two presentations that we've had that were big presentations, the one by Daniela Dominguez and the other one by Sarah Rock, and discuss that. I'm kind of thinking that at this point we just need to talk among ourselves, and it's possible that with Sarah working with the county, that in the future we might want her to help us, but it may be as in her role as consulting with the county. I don't know. What do you guys think about that?
I think it sounds like a good idea to me.
Okay.
It's-
Yeah. Pardon? Okay, so we'll just plan on 9 to noon on the 22nd. Okay. So Tori, if you can put that out, and I'll put together something of an agenda if anybody has input that on what I'll put together a proposed agenda, and then you guys can give input on what I've missed. But
I'll send out the Zoom.
okay,
Yeah, and then if it's okay with you, once you send me the agenda, I'll send out the Zoom and the agenda. If that works.
and it does work as long as you know that the first agenda I send you is a rough draft, because I'm sure that other people may have better ideas than me.
Completely understand. No worries.
Okay. Okay, so I forgot that part of the board planning. Okay. Inviting Board of Supervisor representatives to mental health board meetings twice a year. And that was Supervisor, who is it in 4? Is it Gore? Who's your supervisor? Yeah. So that was his idea. And you did invite him, right? Last month? Bob?
Yeah, I did invite him, yes, and obviously he didn't show, so that's a little
Right,
bit
so-
ironic.
Yeah, so it was his idea. So I don't know that, I think that the information that I sent them on what's in our bylaws clearly said that a Board of Supervisors member was supposed to be part of our membership. And we've asked multiple times and told them that multiple times. So I think that we can invite them and continue to invite them, but I'm not holding my breath.
I have a question, or
Yeah.
for discussion anyway. I don't know what our approach exactly, what form it is taken, but have we ever made an effort to have something on the agenda, the Board of Supervisors agenda, where they actually are presented with the situation and have an opportunity to discuss during their board meeting how they might want to solve this, and if each member comes to 2 a year and how they work that out and so on. Have we ever had it on their agenda for discussion?
No.
Because I
And-
think things seem to get lost if it's just staff, their
Yeah.
staff and so on. None of the supervisors ever, it never comes to their attention, and certainly not collectively.
Right. I have put 2 things on the agenda or attempted to. And there's kind of a rigorous vetting of what goes onto their agenda. So an attempt can be made to do that.
Well, if possible, I understand it's difficult. It's kind of an impermeable boundary there.
Yes.
But possibly approaching it with, the initial thing of per state mandate, a supervisor, at least a supervisor, board of supervisor is supposed to have a liaison function with the mental health board. Here's a possible solution that was actually suggested by one of your members. Can you discuss this during your meeting?
So I will make that attempt.
Good luck.
Thank you. Yes, it may just be an attempt, but I'll make it. Okay. Okay, so I totally embarrassed myself at the last mental health board meeting by not remembering that it was Progress Sonoma that we visited, and blubbering away. But we did visit, and I don't think that you have received the copy of the site visit report. It was a really good visit, and they did an excellent job of presenting their program, and they took their phone and guided us around the facility and all of that. So
Mobile Zoom, right, Kathy?
what?
It was a mobile Zoom. They took us right through their facility.
It was wonderful. I mean, it was really a very good tour, and a very they were very competent in their answers and complete. So it's written up. I will I think I'm going to email it out, but Bob, I'm going to defer to you. Anything that gets that the whole board sees is supposed to be made available to the public. So in this case, it was a very positive review, and you're muted, I think. Bob, you're muted. Okay.
With Becky, we reviewed, and Tori, Buckaloo programs, and that was very impressive. It wasn't, we start out with one of their supportive housing, the manor house and the private apartments, but then went on to all their programs with FAC is another one on forensic, suicide prevention, and others, 7 programs. And they're very enthusiastic, and the CEO actually was there. And as you know, they have programs in Marin County, Sonoma, Napa, and suicide prevention Lake and Mendocino. So they didn't restrict it to the 2 facilities, but we also saw didn't do a Zoom walkthrough, but they had pictures of all the facilities inside, outside, and then they're very informative. So that's another positive experience. Tori, I need to get Tori some more information, but we'll review that, and then we could get that out to the executive committee. But there's nothing in that report that can't be seen by the public. I mean, it's very positive, enthusiastic group. I don't know, Tori, do you want to, you were there, Tori, what'd you think?
I thought it was really interesting because I work with these people so often that it was really nice to see them in, in person, so to speak, but also to see the facilities that we partner with, behavioral health partners with. And the same with the Progress Sonoma. I had never seen those houses either. So that I really enjoyed both of them. It was very interesting. I thought it was very positive as well. Very encouraging, and both of them do amazing work, and it's really awesome.
I guess, Kathy, one of my thoughts is that rather than have the reports or their site visits kind of buried in a report, they would make a very fine presentation to Mental Health Board to brief each of these facilities so that people can learn a little bit about them. I don't know what the group thinks of that, but I think it'd be very informative to spend a little bit of time in the Mental Health Board meeting, a hearing from these agencies that we're conducting site visits. Just a thought.
Okay, so are you proposing to do a brief report that you and or whoever visits presents and not email the detailed report to everybody, or what? The interviews to everybody?
I think we could still email a report to everybody, but I was thinking rather than the site visitors, having the agency present a brief overview of their program. As part of the site visit, we learn about the program, we put it in a piece of paper, we send it around, but to actually see it, I think we felt that way at Progress Sonoma and also with the Buckaloo programs would be very informative. That's what I'm asking.
So have the program present at the Mental Health Board meeting?
Yes.
Okay, so
So here we would ask the next one, board meeting, not this month, following month, have a brief presentation from Progress Sonoma about their programs. And each time we do a site visit, we're learning about it, but the community isn't learning about it. There's people will review the minutes or report. I think it might be helpful to get an understanding of the quality, diversity of the programs being offered in the county.
So the only reason I'm asking the question is that we have had two very positive visits, and if we had one that was less positive, I mean, these reports, if they're going to the whole board, should be, according to the rules, public. And if we had one that was not as positive, then that would also, have to follow the same rules. So, I'm asking if Tori should send these site visit reports to everybody, which would then make them something that the public should see. So you can think about that and answer it later. At this point, we've talked about them, and everybody hasn't seen the reports, so.
Well, Tori and I are working on the Buckaloo programs. We should get that done by next week. And then we could send that out. We don't need to send it out for this month's Mental Health Board. In fact, probably be better to wait till June, but May we could do the Progress Sonoma, and June we could do Buckaloo. And then I need to get in touch with Bill and get an idea of what other programs to visit. And of course, I need one volunteer, like Betsy has volunteered to be one of the site visitors, I know. And then Bob, I'm sure, is anxious, and Michael. It's actually very informative. It's really very low stress, but you do learn a little bit about it. And actually, after I've after conducting, this will be I've done 4 of them.
Yes.
I think we could fine tune the questionnaire too a little bit more. But anyway, it's a worthwhile experience because you get more of a sense of what services are being delivered in the county.
Okay, so I agree, and I see a NAMI comment that it would help educate people about what exists in terms of a continuum of care in the county. Each program and service could be identified as to where they fit into the continuum. And, you know, I agree with that. I'm just alerting, I guess, all of us that these should be made public then.
Yes.
And I think that it's appropriate that they are. So,
I think so, because the county is spending the money on the programs, and then the people of the county should be some feedback about how they're doing. So I don't think there should be any secrets.
okay, perfect. And Tori, you can, when we send them out, you can attach them to. We'll just get-
I see his hand up.
yeah, Bob.
A couple things. I don't know that we have anyone at the present meeting who, and possibly Marianne, who was aware of how these reports were handled historically as far as availability, how they were distributed amongst the board versus public or not. I certainly think that they should be public documents. We're working on them. Everything we do basically is transparent, such as this meeting. And it, of course, that Kathy brought it up a little bit, sort of come what may, whatever the outcome of the report or the visit, that will necessarily be public, whether we're thinking very positively or we discover some chinks in the process. So I would support definitely having them public. But my question is, how was this handled in the past? I don't know. I was on a single PAM, in-person PAM visit, but I don't know what happened to that report once it was finalized. Does anyone have personal experience on that?
I have done site visits in the far past. And
in the written guidelines for it, it says the report should go to the executive committee. Then the executive committee is supposed to forward it to the mental health director. At least that was
yeah.
us.
So the report should then probably be in the executive committee notes.
That was the
And
intent.
it has not in the past. I don't know where it went. I know that I wrote things up and I gave them to the chair at that point. But it was in person and we didn't have all of this, email kind of availability to just post it. So I don't know that it was posted as part of the minutes, but I believe that it should be.
Then in future, certainly if we don't do something retroactively, I think that we absolutely need to notify the agencies we're visiting that whatever the outcome of the visit, it will be made public.
That's true. Okay, I see Bob Hale's head nodding.
Yes, I think it's a good. I think Bob makes a good point.
Okay, so that is that I will. Tori, you have the report for Progress Foundation, and you have Bob Hale's other report. Do we need to decide on which facility is next and who's going to visit with you, Bob? Or
That's our next agenda because we've in previous reports, I don't know what happened to them, but Parker Hill Place and the CSU were two that I looked at, and I think you and I were scheduled for some just before the pandemic was
and
restricted.
one with CSN. It was definitely CSN that we were scheduled for.
But I guess the next point is what are the next sites we should visit we focus on crisis residential treatment and adult residential and supportive housing programs and adult residential treatment. So Project Sonoma is a crisis residential treatment facility, and adult residential treatment facilities, Parker Hill Place, Manor House, and McBride are supportive housing programs, and they have other facilities or other programs. So, but I guess what should be the next couple? I don't have the answer to that. I was going to ask Bill.
Yeah,
Things he thought would be most appropriate.
yeah. In my well, I told Bill that I had looked into housing for conservatees, and I found out that Parker Hill only takes people who are conserved. So those are the 12 people that are in 1 year housing. There are some others that are board and cares that take conservatees, but there's one for men, which is Hope House, I believe, and it has 8 people. And Brown Street has 2 people who are conserved, and both of those would be acceptable to a to the conservator for somebody to be placed there, but those are 2 of the only places that people can be served if they're conserved. So those are both part of CSN. Maybe that would be a place to look. Maybe the 2 of them.
Yes. So Hope and Brown Street.
Yes. I'm pretty sure that Hope House is for men and Brown Street is for women. But you could check and see what the counterpart to Brown Street. I'm pretty sure that.
Will do.
So that's a suggestion for one. And then CSN has multiple programs, but they're very different. So, it's a broad range, just like Buckaloo had.
One program I was wondering is the mobile teams, mobile support teams.
That would be an interesting one too. That's more just talking to the people.
Yes.
That are running it, but it would be interesting to talk to them too. So, okay, so whatever Bob Hale decides, wherever he decides to visit, is there somebody who would volunteer to visit with him? It's likely to be Zoom, and it's a very painless process. Looking for volunteers.
Do we have dates and times at all? Is that'll make the difference for me.
Oh, what I'll do is I'll work with the agents. First, I'll get dates from the other person who's going to do the site visit. And then I contact the agency and then work it out with them. But it'll be at a time that if you're going to be one of the site visitors, it'll be a time that won't conflict with your schedule, Bob.
Okay. Well, definitely keep me in the loop on that, and let's see what does work out.
Carol West has said she would. Michael, are you interested in doing that?
Yeah, particularly for whatever I'm needed for, but the mobile support teams, I'd be especially interested in checking out.
Yay, Michael and Bob and Carol.
And Betsy had her hand up too.
Betsy is
good, important task, and I think people will enjoy it. So you have to allocate 90 minutes. Usually
Yeah. as long as I have like a week and a half notice.
Oh,
You know,
no,
I-
you'll have about 3 weeks.
Okay, yeah, that's plenty of time for me. Won't be a problem.
Bob, were you suggesting that there might be a slight revamp on the survey or the paperwork prior to the next meeting, or just eventually?
Well, I would like to give it a try even before the next meeting, but it just depends how soon we could get the agency, because I don't want to do it unilaterally, because if I make changes, I want to send it around to the executive committee, because you all have always good ideas and get your feedback from it too. So I don't have a timeline on that. I just know that looking at some of the questions and from doing it recently a couple of times, I think some of the questions might be redundant and less applicable. I don't know, Kathy, what do you think?
Yeah, I think that there, I felt pretty comfortable with all of the questions. The only thing that I might wonder is if there was a way for us to get even some written feedback from some of the consumers themselves, the clients.
That's one thing that doesn't happen, because when we went there, we'd always interview a consumer. And if it was we didn't interview, go to any child programs, because we went to programs that provide services to children, then we'd want to hear from the parents. But we haven't done, with the site visits, when it's on site, you could do that. Sorry, it's a dog.
It's kind of cute.
I'm babysitting my wife's dog. It's a new experience, but I think in the site visits, I really think though that people will enjoy the experience, but also the questions, I think we're pretty good shape too. We've changed it somewhat, and we'll ask them to submit some information on the forms, which speeds up the process. And before we interview them, they'll have this copy of the forms. I send it to them, so they know exactly what questions we're going to ask. So there's no surprises.
I'm wondering if it might be helpful to have them have the consumer form and just ask
Yeah.
if there's any consumers that would be willing to fill it out.
That's a great idea, Kathy.
Because then they could just, hand us the results. And probably, I mean, they could cherry pick what consumers they asked, but you'd probably get information anyway.
That probably happens when we do the site visit itself too, because they ask tiers. So
Right.
there's no way we can prevent that, but I think the consumers will speak their mind, I hope.
I think they would too. Yeah, so, okay.
Would you want to send the consumer form to the Progress Sonoma people and the Buckaloo people?
We could do that and ask them if there's anybody, ask them to ask if somebody would like to volunteer to fill it out. I think that would be a good addition.
Okay.
Okay. Anything else that you need from us on that?
Oh, no.
Okay. Okay, so acknowledging the behavioral health staff, I'm going to print up the certificates, all of them that we have done so far. So that's 4 that we've done so far. And we need to figure out who's going to be this month. I've made suggestions so far. I'm willing to take somebody's suggestion. Last month we did Barbie and Erica. So yes.
Were we thinking, were we going to be alternating agency, individual, and so on? Or are we doing an agency and an individual each month?
Erica was officially from the month before, and she was officially the individual. Barbie was supposed to be an organization that month, but excuse me, since she was leaving.
So are we on an individual at this point?
I think that that's up to, I think that it could go either way, because Barbie could go either individual or, you know, as Mary Ann said, Barbie was an organization to herself, but but she really was an individual. So I think that we could do an organization this month, and we're just off. But it's our schedule to be off on. Nominations.
I would nominate NAMI for their having stepped up, been kind of gatekeepers during a lot of the crisis, and their ongoing efforts basically. But they were kind of a hub, continue to be a hub for many services that folks need, and an access point. I'd like to acknowledge them.
That's a great idea. I would support Bob on that one. Because I worked with NAMI on the jail project, and it was very productive.
Okay, any objections to that? Hearing none, NAMI is on. And I think Mary Frances is probably listening, so be there, Mary Frances.
Mary Frances has been very, very helpful. With the
Yes. Yes. Okay, Mary Frances is sending a smile, so she will be there. Okay. Special presentations, I'm working on that. Mental Health Awareness Month. Ha. That was a good thought. Yeah, Carol said that she might write something, but I don't know that anybody has done anything, except there is the list that Melissa put out of activities, and that's all that we really have that I know of. So at least at the Mental Health Board meeting, we should acknowledge that May is Mental Health Month, but my mind is blank. Yes, Bob Cobb.
I agree that it certainly should be acknowledged at our mental health board meeting. The problem of any other public acknowledgement in the media or whatever is the lead time required there
Yes.
for us to generate it, the lead time for them to publish it, and it would seem to have less impact if some acknowledgement came out toward, at the very end of the month. So unfortunately, I think we've missed that opportunity.
I think we have too. Okay, so I'm not hearing anybody else. So I think we missed that opportunity, but we will acknowledge it at the Mental Health Board meeting itself. Retreat date, we got May 22nd. I don't think that moving agenda item 12 is discuss moving the Mental Health Board meetings to Wednesday, so supervisors can attend, and I honestly don't think we would get more attendance that way, but that can be a part of, if I contact the Board of Supervisors and get the question about their attendance and how to resolve that issue on the agenda, I will include the idea of moving the meeting to Wednesday.
Yeah, they just asked a question. What would we agree on the agenda for the retreat?
What did we agree on? We're going to, Say that again.
What was the agenda for the retreat again? Just,
So we left Sarah Rock's presentation on ACEs. And we were planning on coming up with some sort of a statement as a mental health board. And then we had the discussion, the presentation by Daniela, Dr. Daniela Dominguez, thank you. Oh, my mind. Yeah, so we were going to discuss those two, those two presentations and come up with a statement of direction, a statement of like a vision statement or on that included the contents of those two. Okay. Mary Frances sent a message saying that May 11th at 5:45 p.m. NAMI is hosting an attorney on mental health laws of California to know, and it's a Zoom presentation. She's going to send me a flyer and I will forward it to the board. And Tori is going to has asked to get one as well. So May 11th. Oh, something just hit my head that I wanted to add and I have lost it. Okay, given that that's gone, does anybody have anything to add? Okay. I'm giving my mind like 30 seconds to see if it comes up with what I was going to say. Because it was important when I thought it, but it's flown the coop. I've got nothing. So
Where were you on the agenda when you were going to be presenting whatever it is? What point were you at?
Yeah, whatever it was. I was looking at I don't know. I think I had gone back and something had hit my mind. It's not coming back to me. So I'm scanning my notes and I'm not seeing it.
Okay, then you could, if you want to look at number 15, future topics to add to agenda. Whatever Kathy remembers after this meeting, it will be on the agenda for next meeting.
Yes, it will. Okay.
Kathy, I have a quick question just to clarify
Yes.
on the agenda. Did you want me to remove the Wednesday, changing our meeting to Wednesdays for the Board of Supervisor attendance? That's like a standing thing. Did you?
I think just remove it as a standing thing. And I will put on my to-do list. So what I am going to do is contact the board with the question of how to resolve attendance.
Okay.
And I'm going to email Bill the information about conservatees. Okay.
I have a quick question, Kathy. When I believe Becky did her presentation a couple months ago or before the board. Who was able to get that on the agenda? Was that Tori? Was that you? Or how did it get onto the Board of Supervisors agenda?
I filled out the request to be on the agenda.
And did that go through like Lynn Hopkins' office and she was the chair or president of the board at the moment, or?
No, there was there's a contact, which I would have to look up in my email.
Okay, I just was wondering what the avenue that we've been successful with before.
Well, there's a contact person, and that contact person passes it through another person. So there's several steps that I'm not aware of that happen behind the scenes. So one person gets it, checks for approval with another person, and then the agenda, the Board of Supervisors agenda is set. So I'm not sure exactly what happens behind the scenes, but I do have. Yes.
I'm sorry. I think I can help with that one. I believe our CBID office is our contact. So Russell Carpenter, he was the one that was sending you the forms to complete, and then we return them to him, and he works with the board, getting everything in order. I believe that's who we were working with.
Yes.
Again, my memory is a little foggy too.
That name sounds familiar. I would have found it back in there, but I'll look for his name in the in my emails, and that will be helpful. Okay. If nobody else has anything, speak now, or we will go ahead and adjourn the meeting. Okay, I am not seeing anybody. Are you, Tori?
Nope.
Nope. Okay. The meeting is now adjourned then.
Thank
See you
you.
later.
Bye.
Bye.
Hey.